Hi, this is Shalu Kumar from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK, and I'm also the lead trainer for OSCE nurse training Cambridge. In today's video, I'm going to cover assessment station. In my previous video, I gave you overview of all the 10 stations you need to do to pass your OSCE exam. So go ahead and watch that video if you haven't watched that already. I have added the link to the description below. Okay, so let's talk about assessment today. So I'm going to give you a little bit more information about assessment station and also give you my 5 top tips to pass this station. Okay, so assessment is a 20-minute station, and this is the station you're going to meet your patient, and so this is going to be a real patient scenario. Rest of your stations are normally with mannequin, but assessment station is with a real patient, means an actor who will be acting up as a real patient. Okay, so 20 minutes with a real person. And also, to help you with the station, you get given a patient overview history form, which is on the screen now. So this form gives you prior information about your patient. So this tells you your patient's presenting signs and symptoms, why your patient is being admitted to hospital, patient diagnosis, patient previous medical history, surgical history, family history, social history, medication your patient is taking at the moment, and also any allergies. Okay, so it gives you kind of overview of your patient clinical condition and past history, so it helps you with your assessment station. Unfortunately, there is no added time to read this paper. It needs to be done within the 20-minute time. Okay, so you're on the day, your assessor will give you introduction to the station, give you a briefing. Assessor will start your 20 minutes, and the first thing you should do is read this form to get to know your patient better before you start an assessment on your patient. Okay, so this is just the paperwork you get to read beforehand. So let's talk about the assessment station itself, but step by step. Okay, so like any other station, assessment station is started with the scene safety. You're going to make sure your scene is safe before you proceed. Then you're going to draw the curtain or close the door to give your patient some privacy. Okay, then you're going to go ahead and do full hand hygiene as per WHO Health Organization guidance, and after that you're going to make sure you do full identification check on your patient. So do it systematically. Make sure you ask your patient for the identification details. You check those details against your patient wristband, the name band on their wrist, and then also match it to your documentation, which is your patient history form. Okay, and you need to follow the same checking procedure for any allergies as well. Okay, so you check the allergies against allergy band and also against your documentation. Now once you have done that, explain to the patient what you're about to do and take a valid consent. Okay, once you have taken the consent, then move on to assessing your patient's pain. Okay, so you're going to ask your patient about the pain score. So you can use the universal pain tool of 0 to 10. Ask your patient if they already had some pain relief. Once you have addressed the pain, then move on to performing your vital signs. Okay, so for vital signs, test center is going to provide you a blood pressure machine and with a saturation probe, and also a thermometer to check the temperature. Okay, so you will use the machine to do your patient blood pressure, their oxygen saturation, and then go ahead and check the temperature. Once you have done that, then you will go ahead and check the heart rate, counting it manually. Okay, don't take it off the machine, you have to count this manually, and then for 1 full minute, and then again for 1 full minute count your patient respiration. Okay, so that's full set of vitals. Once you have done that, then you need to plot these vitals on a chart. So there are 2 different charts in your exam which are on the screen now. Okay, so one is national early warning score. So if your patient scenario is a medical patient or a surgical neurological patient, pre-op patient, then you will be asked to complete a national early warning score chart, okay? If your patient is a neurological scenario, then you will have to complete neurological observation chart, okay? So in neurological scenario, you will do patient vitals, but additionally, you will also have to perform Glasgow Coma Scale. You have to check your patient pupil size and reaction to light, and also their arms and legs strength assessment as well, okay, as you would do on any neurological patient. So you will have to plot those on a neurological observation chart and also your vitals on the neurological observation chart. If your patient scenario is set in community, okay, so if your assessor is asking you to assume that your patient is at home or in a nursing home and you've been asked to do an assessment, you would still be completing National Early Warning Score chart, okay. So the two charts you need to know how to complete are the National Early Warning Score chart and neurological observation chart. On your exam day, assessor will give you one chart out of the two to complete, okay? And then once you have charted your vitals on the chart correctly, then you move on to doing A to E assessment of your patient, which is on the screen now. So A is for airway, B is for breathing, C is for circulation, D is for disability, and E is for exposure. So you do your A to E assessment systematically. Once you have completed that, then you go ahead and ask your patient some questions regarding their nursing needs, okay. So the nursing needs question will depend on your scenario, so make sure you choose 2 to 3 important nursing needs with your patient to look into and base your assessment on activity of daily living model. So what I'm trying to say is, just assume you got a patient who is short of breath due to pneumonia. So obviously you will talk about patient breathing. Now shortness of breath might affect their eating and drinking, so you may have to look into risk of malnutrition for this patient, and also shortness of breath may affect their sleep, may affect their mobility, okay. So try to choose nursing problems related to your patient scenario. And also in nursing assessment, you need to do physical needs, but also you need to include patient emotional need, any spiritual religious need, any social need, any family need, okay, because it's a comprehensive assessment. Once you have finished your nursing assessment with your patient, then give your patient a chance to ask any questions, do your final hand hygiene, and finish your station professionally. So this is the quick run. That's how you will work your station in your exam. And obviously in our training at ONTC, we look at every step more carefully and prepare you fully, and you will have chance to practice all your stations with your trainer. So now my 5 top tips. Tip number 1. Make sure you do ID check and allergy check in real time, okay? So no pretending. This is really important, and this is a very common fail in your exam, okay? So make sure you are asking the ID details from your patient, checking it against the name band and allergy band if your patient is wearing one, and then checking it again against your documentation, which is your patient overview history form, okay? That's really important, no pretending. Now, tip number 2. Tip number 2 is about valid consent. Do not underestimate taking a valid consent, okay? So explain fully what you are about to do to your patient, and give your patient a few seconds to say yes, okay? Do not proceed until your patient has said yes, okay? This is really important, and again a very common fail in exam. Tip number 3 is about the vital monitoring and plotting. Now in this station, this is the document your assessor is going to mark and check. So there is no room for error when it comes to plotting your vitals on news chart, which is National Early Warning Score chart, or your neurological observation chart. So you should practice. There are some completed examples on my Facebook page, and I've also added the link to this video for you to have a look at the completed example. So make sure you're adding your name, your patient detail, time, date, your signature, everything to that form. If you make a mistake, cross down the whole column and start again in the next column. Like I said, there is no room for mistake when it comes to charting. Practice both charts because you don't know which one will come in your exam. Your assessor will give you the one you need to complete on the day out of the two. Okay, so make sure you do lot of practice. Tip number 4 is about A to E assessment. So make sure your A to E assessment is systematic and complete. So you can use the vitals you have already taken on your patient in A to E assessment. So like for example, you're talking about breathing. So talk about the respiratory rates you have already done for your patient. Talk about the oxygen saturation you have already done on your patient. Ask your patient if they got any cough, any wheeze, any shortness of breath. So these are so look at the respiratory pattern in full. So what I'm trying to say is make sure you know all the elements you need to put into A to E assessment. Okay. So now tip number 5. So tip number 5 is about the nursing assessment. So make sure your nursing assessment is related to your patient scenario. Okay. You don't need to go into every activity of daily living, but you do need to concentrate on the main nursing needs of your patient. Okay, and look at your patient history form again. So this is the form you can use throughout the assessment station. Okay, so use it and it will give you prompt about what kind of nursing needs you need to ask your patient about. Okay, so and also make sure you're looking at their emotional need. Is your patient feeling a bit low being in hospital? Any family need? Is your patient worried about anybody at home? So social needs. So all this needs to be part of your nursing assessment. Now my bonus tip, which is tip number 6. So tip number 6 is all about building a rapport with your patient. Remember, this is a real person in this station. So you make sure you build a early rapport with your patient. You listen attentively to your patient. You show care and compassion. If your patient is asking you any questions or bringing a problem up with you, then answer those questions and address that issue straight away. Okay, don't leave it to end, you will forget. Okay, so you make sure you deal with it straight away. I know it will cost you time, but if that means you cannot go into lots of different nursing problems with your patient, then that's okay. But it's not okay to ignore your patient. You really need to listen to your patient attentively and answer those questions. If your assessor asks you a question, please try your best to answer it straight away. Okay, so these are all my top tips for assessment station. I hope you like the video. It's been useful. If it has been, please like my video and subscribe to my channel. At ONTC, we are still doing 30-minute free consultation before you decide to register for our OSCE preparation program. So please go ahead and visit oscenursetraining.com. In my next video, I will be covering implementation station and giving you more information and giving you my 5 top tips for that station. So watch out for that video and bye for now.